So, Vasilis, we have a lot of stories about ourselves and what we do in our lives and such. Hollywood has this great way of dealing with physicians, and there are always movies that portray doctors, perhaps not necessarily the way actually it works in real life. So tell me about a favorite movie character that's a doctor that you remember.
Well, I have two. And the first one was this movie, Doc Hollywood.
Okay, good choice.
Michael J. Fox portrays a doctor who is going to become a plastic surgeon. He's going to get a fellowship in plastic surgery, gets sidetracked in an old country town, has to spend some time in service, and he realizes his connections to the patients and the community were far more rewarding than having a career as a plastic surgeon in Beverly Hills. And that one resonated with me very well. It was actually written by, I think the screenplay was written, or the treatment was written by an Emory doctor that worked at Grady. And so the story obviously makes a ton of sense. And the other one that I thought was very inspirational in a much different kind of way was a Harrison Ford movie called The Fugitive.
I remember that one really well.
There's a doctor, and he's accused of a crime he did not commit, and he had to somehow find a way not only to get away, but to prove his innocence. And his creativity and how he puts everything together and figures out who actually committed the crime and how he would show his innocence, all while evading getting caught by the police where he wouldn't have a chance to prove his innocence, really kind of spoke to me, because I was like, here's a person who used some kind of his basic skills, maybe what he learned in medical school, or to be creative and to be able to add on to what he was doing and find a solution for a problem that seemed like was very kind of cut and dry or very futile, there was no chance, and he could figure it out. So I thought those two.
I remember a specific scene in that movie which makes me come back to this whole business of taking care of the patient. We've come full circle. And that is, after he escapes from the police and now is on his own and so forth, he is going back near the hospital to get some information about what actually happened during this period of time when he was accused of murder. And there's a shooting somehow, and he runs to help one of the victims of that and quickly looks at him, because he knows he doesn't have very much time, because the police will also come to help this victim, and he is a fugitive. And as they load the patient onto a gurney to take him into the hospital, he says to one of the attendants, "Tell the surgeons to look at his belly, not just at his chest." I don't know if you remember that or not.
I remember that now, yeah.
But it reminds me, it always reminds me of, even though in this terrible, quote unquote, stressful way, in the movies it wasn't quite so stressful for him, but in real life, it always reminds me of, remember what your job is. Remember that the bottom line here is to care for the patient. Yes, there's a big bullet hole in the chest, and that's a good big problem, but the other problem also needs to be remembered and not forgotten to make the patient survive. And I think a lot of what we do during the course of our day is exactly that. We try to think of everything to make the patient better. It sounds a little hokey, but it's true. And if you remember that it isn't just the obvious things, that there are little things, it may be simply speaking to the family. It may simply be to bring in a wife and sit them down and tell them what the real issues are. It may be simply talking to another physician who has sent the patient. There's lots of ways that this can be pulled off and done during the day, but it is part of what makes my day a happy one.
You know, this movie, Men in Black. You've seen this movie? Men in Black.
Many times.
So I think the main character, Will Smith, when he said this is the last suit you'll ever wear, right? Once you put on the black suit, you're Men in Black. And I think there are certain professions where once you don the garb or the cape or the robe or the jacket, etc., this is transformative, because it's not just a job, it's not just a career, it becomes your fiber. Clergy is one of them. Being a parent is another, but being a doctor is the same. And the scene from The Fugitive, because it's just, that's you. And you can't stop or dissociate yourself ever, because it's become part of your fiber. And it reminds me a lot of Men in Black. This is the last suit you'll ever wear. So
It's true. Somehow or another, you don't have a choice. You can't just throw that away and become a different person. I don't know of very many people that even attempt to do that once they get into it.
Well, it's not a career, it's a calling.
Yeah.
And I wish this, regardless of what my children ever decide to do, I wish they can find their calling like I have and like you have, whatever that may be. And I think people have a way of finding this stuff, but medicine is definitely one of those callings.
Yeah. And if they don't like that, whatever they find is good for them, that's fine too.
Yeah. Well,
Yep, I have 3 kids, none of which went into medicine,
yeah.
but all of which have been successful, and I'm delighted with that. But they all are happy in your work, if I may quote another movie, which was The Bridge Over the River Kwai. Be happy in your work.
That's right.
As long as you can be happy every day, that's not a bad thing.
I agree.